itself, in muscles itself, in bone itself, in they have a lot of vitamin deficiencies, they have a lot of mood swings. So all the systems of the body are actually having their physiological changes. We cannot say that is in a bad way, but we can obviously say that it is a new change out there to the female itself. So it is very important that all the components of the physical fitness should be maintained in all the three trimesters out there and in the postpartum period out there. So if you actually go with the good antenatal practice in the pregnancy, so automatically the postnatal care is good. Automatically the postnatal period will be good because the antenatal period gives you a lot of physiological changes, and if we focus on the physical fitness properly, then obviously the postpartum period will be a little lighter. In the antenatal period, which what we are doing, we are actually preparing for and informing both the parents about the pregnancy, labor, and the subsequent care of the baby. Like we are involving the both of the individual, both the parents, because obviously the support from the partner is equally important than the other physical fitness exercises. The overriding goal is that pregnancy will be resulting in a healthy mother and a healthy infant. So our whole goal is actually to increase the physical fitness of the mother. And if the physical fitness of the mother is good, then automatically the infant will be in a healthier stage. It has been shown from the various researchers that women who exercise have less interventions or complications during pregnancy. There is good cardiovascular and respiratory fitness. There is good general body tone, muscle tone, and they do not have any muscle tensions, muscle spasm, or you can say muscle tightness in the body. Shorter labor and speedy recovery, which is equally very important than the antenatal care itself. Talking about the physical and the physiological changes which are present in the pregnancy, there are various hormonal alterations, mediated changes in the collagen and the involuntary muscles. Since we know that collagen is a part of, it's a protein which is present in various organs, so automatically that because of the alterations in the hormones, there are changes in the collagen which is happening. So with the physical fitness exercises and with the proper dietary changes, which we can actually focus on the collagen itself. Increasing blood volume, increasing blood flow to the uterus and kidney, enlargement and displacement of uterus. With every exercise, there is always a good flow which is happening to every part of the muscle, right? So we are actually increasing the flow, blood flow, so that the exercises will help them to recover from the physiological changes that they are having. There is reduction in the smooth muscle tone. There is periastic activity which is reducing. There is constipation. There is uterine muscle tone which is getting reduced. There is dilatation of the uterus which is favoring the urinary stasis and UTIs. Since there are a lot of changes which are happening in the urinary bladder, in the gynecological state, they are having more of the other of the pelvic issue. So it is very important to maintain that strength of the pelvic floor muscles so that their complications will not suffer more. Increasing plasma, then in red cell, consequently, HP goes down to 80%, causing the anemia. Early tiredness, malaise, cardiac output increasing by 30 to 40%, and BP may fall in the second trimester. So, women may easily feel faint during the prolonged stocking. As we know, all the females, they are already involved in the household activities. So since the physiological changes happens in the BP, so if the BP falls, then there are higher chances of their faintness, right? So with exercise, it is very important that BP is maintained. So if BP is maintained, there are low chances of them actually feeling the headache, feeling the dizziness. So the exercise protocol which we focus is actually should be focusing on the cardiovascular fitness also, so that the BP gets maintained. Water retention causes unusual pressure on the nerves, resulting in neuropraxia, mostly carpal tunnel syndrome. We have seen cases in the our department of in every department. We usually see cases with carpal tunnel syndrome in the postpartum stage or in the antepartum stage. That is because of the unusual pressure on the median nerve which is happening. So this is one of the most commonest symptom out there in the pregnancy, because there is a lot of water retention in the body which is happening. Traction of nerves, paresthesias of hand, mood liability, anxiety, insomnia, nightmares, pelvic floor laxity, and stress incontinence. These are one of the factors which are happening and physiological changes which are happening in the woman. So it is very important that we should be focusing on every component of the body, which we will discuss later in this presentation, that how we as physiotherapists are actually helping them in maintaining all the structures of the body and all the ignoring all the disorders which are happening in the pregnancy outcome itself. Coming to the musculoskeletal system, we as physiotherapists are mostly dealing in that way. As a mental well-being of the patient, it is very important that we are supporting the patient in a psychological way. But talking about our role is mainly on the musculoskeletal system. There is generalized increase in the joint laxity. So whenever there is a generalized increase, oh, it is not changing. Let me share it once again. I think now it's visible. So there is generalized increase in the joint laxity, and as we know, if there is a generalized increase in the joint laxity, there are higher chances of the injury itself. So it is very important to note down the pregnant woman. There are high chances of the because of the weight and because of the joint laxity. So there will be more chances of injury itself. The posture modifications to maintain the center of gravity and line of gravity is very important, because already because of the anterior pelvic tilt, it is getting shifted out there. Increasing lumbar and thoracic curves, increased anterior pelvic tilting, back pain because of greater load on the spine and torsion stress on the joint. So whenever there is an antipelvic tilting which is happening at the lumbar, it produces the back pain itself. So patient posture modification is one of the most important factors itself. Clumsy gait on inclined surface, that is because of the posture and because of the overweight, and because of the increase in weight issues. So clumsy gait will help in that sense of that we are actually giving them strengthening exercises and the stretching exercises itself. Diastasis recti, that is a separation of the abdominal muscles, is one of the commonest complications which we deal in antenatal care. Imbalanced muscle recruitments, ankle and foot edema causes muscle weakness. Abdominal muscles are stretched and efficiency of contraction is decreases. Pelvic floor muscles drop as much as 1 inch. So there is always weakening of the pelvic floor muscles, which happens in the antenatal care. Peduncle nerve compression occur during labor, so thus pelvic floor is vulnerable for from both muscular and neurological perspective. So whenever there is a labor happening in the normal delivery, there is a compression of the peduncle nerve. So in that case, the pelvic floor muscles is always prone to have some of the changes of the muscular and neurologic perspective. So it is very important to actually strengthen the pelvic floor muscles so that the compression doesn't give symptoms too much. Now, exercises which we actually preparing for the patient to birth. That is one of the most important things, that what exercises and which exercises and in which phase the exercises are doing. So muscle groups which we target during pregnancy are the groups which are important in the posture and which are easily getting weak. First is the abdominal muscles. They are getting strengthening to support the increasing weight of the baby. since the weight is getting increased. So it is important to maintain the strength of the abdominal muscles. Pelvic floor muscles, strengthening of the muscles will permit genitals to widen more easily during childbirth and so prevent urinary problems like urinary incontinence after delivery. Continence is one of the major complications during the antenatal and the postnatal care, and the urine infections also. So it is very important that we strengthen the pelvic floor muscles taki when during the labor, since if the normal delivery is happening, so we are actually preparing the pelvic floor muscles to help us during the labor to permit the genitals to get wider. So if the pelvic floor muscles are well strengthened, the genitals are more be easily widening up. If they are tight and if they are weak around there, then there's higher chances of getting a cesarean delivery, or there is not chances of getting into the labor and the contractions. Back muscles, that is because of the posture part. Strengthening of the back will improve the posture and minimize the strain of the pregnancy on the lower back and help prevent discomfort caused by the poor posture. So back muscle strengthening is equally important ताकि posture अच्छा रहे, and postnatal period में if they are trying to decrease weight, so automatically if the back is strengthened, so उनका जो weight bear जो weight है during the antenatal period वो भी ज़्यादा नहीं. Posture exercises, abdominal exercises, stabilization exercises we have, pelvic motion training and strengthening we have. We have modified upper limb and lower limb strengthening with therabands or weight. Perineum and adductor flexibility exercises. Very important that we stretch the adductor muscles. जितना हम adductors की muscles को stretch करवाएंगे, pelvic floor muscles की strengthening कराएंगे, उतना ही वाइडनिंग और कॉन्ट्रैक्शंस जो है जेनाइटल्स की वो जल्दी होगी और लेबर प्रोड्यूस होगा. रिलैक्सेशन एंड ब्रीथिंग एक्सरसाइजेस. We have aquanatal exercises, which are not much common in India right now, but still out of India, it is getting more in the common phase. So many women find aquanatal classes very enjoyable during pregnancy. And exercising while standing in the water should be gentle on the joints and can help lessening the swellings in the legs, which is a common symptom in the late pregnancy. So, aquatherapy actually helps in more mobility and increasing the swelling which is present in the ankle itself. Yoga and stretching can help maintain the muscle tone, the flexibility. Uh, it may be it requires a proper regime by walking a few times a week to give your heart a workout. So you will be more supple as a result of the effects of the relaxing, which causes the ligaments to be more pliable. And we should not hold the stretches for too long or try to develop your flexibility too much. So yoga should be in the limit. Like this over stretching हमें नहीं कराना है patient को. Normal stretching which is there for 15 to 20 or 25 seconds per stretch is enough. We cannot overstretch it because joint already laxity में है, so there are higher chances of ligament tears. Pilates is one of the exercises which combines flexibility, strength, and the training with body awareness, breathing, and relaxation. So Pilates में अलग combination होता है flexibility, strength, breathing, and relaxation. The exercises are based on certain movement patterns performed with the tummy and the pelvic floor muscles, which is known as Pilates as the stable core or the base. Muscles which are known as deep stabilizing muscles, and because Pilates targets the tummy and the pelvic floor muscles, these muscles can weaken during the pregnancy. So Pilates is a high form exercise. It is not a normal mobility exercises, right? So it requires a lot of practice and requires a lot of good technique and correct technique. So with if the techniques are correct, then it's fine. But if the techniques are not correct, then they automatically there are higher chances of injury that can happen. So it is very important that we should first focus on the basic mobility exercises which the patient can do, basic strengthening exercises, and then depending on the flexibility and the strength of the patient, we can go for the Pilates. We have low impact aerobics. Aerobics, it is a constant time slot which we give to the patient. And we can also go with some walking, which they can do like twice or thrice a week or daily, depending on their strength and depending on their flexibility. Now, coming to which is the most important thing in today's presentation, that is your exercise prescription. What exercises and in which semester, which are what exercises which we are giving to the patient. So I hope my screen is available to you. Is my
Yes,
screen
ma'am.
available?
Yes,
Okay,
ma'am.
thank you. Talking about the first trimester, we have certain symptoms which are present in the first trimester. That is because of the nausea, we have vomitings and everything. Keeping that things aside, this is the exercises which is given to the patient. And our first trimester is from 1 to 13th week, and weight gain is generally 0 to 2 kgs. हमें बहुत ज़्यादा भी पेशेंट का वेट नहीं बढ़ाना होता, ताकि पोस्टपार्टम में दिक्कत ना हो फॉर द वेट रिडक्शन. सो इट इज़ वेरी इंपॉर्टेंट कि आपका पेशेंट कितना वेट इंक्रीज कर रहा है और कौन से ट्राइमेस्टर में उसने कितना इंक्रीज किया है. So first trimester में, if you talk about, it is 0 to 2 kgs, which the patient goes, and it is normal. We have this certain exercises which patient can do other than the mobility exercises. First is the modified squatting exercise, which is done with the wall support. That is one of the adductor stretches which patient can do. If you see it in the figure, it can be done on the wall or it can be done in the normal sitting position, which we can do. But if we are doing under the in the face of the wall, then there are higher chances of increasing the blood supply. तो जो हम नॉर्मल बटरफ्लाई स्ट्रेच या एडाप्टर स्ट्रेच कराते हैं, उसमें इतना ब्लड सप्लाई इंक्रीज नहीं होता जितना हम इस स्ट्रेच में कराते हैं. तो हमें उसमें ज्यादा ब्लड सप्लाई इंक्रीज कराना है और ज्यादा उसको स्ट्रेंथन कराना है. सो दिस इज वन वे to actually go for the stretches around there with the help of the wall support. Second is the lying down stretch, which is normally done with the ankle plantar flexion and your upper body stretching. Holding for like 5 to 10 seconds or 15 seconds according to the patient's say, and then you can release it. Bridging, as we know, कि ब्रिजिंग बैक पेन के पेशेंट्स में और हमारी ग्लूटेस मसल को स्ट्रेंथनिंग देती है, तो हमें उसकी स्ट्रेंथनिंग के लिए ब्रिजिंग करवाना है. Next, you have wall support standing, that is basically done with the posture corrections. So wall support standing is also one of the most important exercises, because if you see it in the diagram, it is actually placing the arms to the upward direction. So we are actually modifying the posture. तो जितना हम posture को modify करेंगे, उतना ही patient का back pains और complications कम होगा. क्योंकि फर्स्ट ट्राइमेस्टर में इट इज नॉट मच ऑफ वेट इंक्रीज. सो फर्स्ट ट्राइमेस्टर में ही वी हैव टू फोकस दैट इन द थर्ड ट्राइमेस्टर द बॉडी इज रेडी, द पोस्चर इज रेडी टू इंक्रीज दैट वेट, टू एडजस्ट विद दैट वेट. उतना बॉडी को प्रिपेयर करना है हमें. Give me a second. I'll share it once again with the solution. In the next slide, we have certain exercises which we can do on the Swiss ball. And on the Swiss ball, anterior pelvic tilting, anterior pelvic tilting, sorry, on the Swiss ball, there are higher chances of the anterior pelvic tilting which happens in the pregnancy patient. So on the Swiss ball, we can always go for the posterior pelvic tilting exercises and with the TheraBand. So आप upper body की strengthening करा सकते हो with the TheraBand on the Swiss ball. So if you see it on the figure itself, the lady is actually strengthening with the TheraBand on the Swiss ball. एंड स्विस बॉल का अपना बहुत ज्यादा रोल है प्रोप्रियोसेप्शन में एंड बैलेंस में. सो स्विस बॉल gives us a good proprioception which actually help us to maintain the posture itself. Stretching, full back release, you can go with this type of stretch in which the patient is sitting, and we can ask the patient to move in the forward direction. But this exercise should be avoided in the patients who have back pains or who have pain in the flexion side. So that will increase their pain itself. Pelvic flexibility exercises on the chair with teaching the patient how to do a posterior pelvic tilt is important. This was the first trimester that was done. On the second trimester, our focus will be on stretching, balancing, and the posture correction and the strengthening part. बिकॉज सेकेंड ट्राइमेस्टर में वेट थोड़ा और इंक्रीज हो रहा होता है, तो हमें बैलेंस पे और प्रोप्रियोसेप्शन पे और स्ट्रेंथनिंग पे ज्यादा फोकस करना होता है. So stretching, we have upper limb stretching, biceps, triceps, which we generally do, trapezius, pectorals, all the stretchings which we do particularly to the patient should be given, targeting all the muscles which easily gets tightened up. So we know the pectorals, the trapezius, the triceps, the upper thoracic. There are all the muscles which are easily getting tightened up. So it is very important to maintain that stretching itself. And one of the most important muscle which gets ignored in many patients and which we do not stretch, that is the sternocleidoid mystoid muscle. So SCM key stretching is equally very important than the trapezius key stretching. And since patient might have some headaches or neck pain in this period, so आपको हमेशा SCM की stretching, trapezius की stretching, pectorals की stretching करवानी है. Other stretch you can go for is the bicep stretch and the tricep stretch. Talking about the trunk and the complete spinal stretch, this way you can perform with the patient. Is there any disturbance? Abhishek, I can hear you actually properly. Okay, yeah, it's okay. So complete spinal stretch you can do to the patient itself. This is the complete spinal stretch in which we ask the patient to completely squat, and then while holding a bar, you can actually stretch the whole spine itself. I would suggest in this exercises there is no need to go for the neck flexion, because if we go for the neck flexion, the patient might feel some or the other pain in the neck, or they can might feel some vertigo. So it is important while the patient squat and just hold the bar, hold it for 20 seconds or 15 seconds as the patient say, and do it for 3 to 4 times. Now we come to the back and shoulder stretch, which we generally do. Uh, so my slides are getting stuck. I hope my slides are visible to you.
Yes, ma'am.
So we have shoulder stretches around there, the patient can perform on the chair, like placing a chair in front of them, and then we can ask the patient to with knee flexion and lumbar flexion. They can lie down on the chair and maintain this stretch for 20 to 30 seconds. We have a cat stretch, which we generally do in the cat and camel exercise. So this is the way they can go for the cat stretch. But I would suggest if you see that there is a lot of flexion that is happening at the thoracic joint, then this stretch should be maintained for a little period of time. Then the camel stretch. Mermaid stretch. It can be done on the mat itself with this technique, like we are actually flexing the knee and we are going for the side flexion of the body, for the side flexion of the right side and side flexion of the left side. Partner twisting actions are very important. Since the mental well-being of the patient is very important, if they have the partners exercise routine with them. So partner, they can also help with the hamstring stretchings and various stretches of the body. Downward dog portion can be done if the patient is not having symptoms in the back with the flexion itself. अगर किसी पेशेंट को बैक पेन है और फ्लेक्शन की साइड में पेन है, तो आपको डाउनवर्ड डॉग अवॉइड करना पड़ेगा. अदरवाइज इफ देयर इज नो पेन, द पेशेंट इज गुड विद द मसल्स, you can always go with the downward dog exercises. Child pose, which we actually do in the low back pain patient, is very helpful in the sacroiliac joint. Lower limb stretches, lunges if the patient is not having knee pain. अगर patient को knee pain है and if they have some issues and they have some balancing issue or the discomfort, then you should avoid lunges. But if the patient is doing well, always go with the lunges, because lunges give you the strengthening of the major quadriceps muscle, जो हमें actually help करता है during the labor. Partner surrender stretches, perineal stretches, the hamstring stretches are equally important. Butterfly stretch, which is generally done in yoga, and the adductor stretch, which can be done. Partner squat is one of the important components, because squatting ka proper technique to teach, that is your duty, because and the partner is also performing a squat and the female is also performing a squat, gives her a more motivation, because they have to go with the proper strengthening of the quadriceps muscle. Seated hamstring stretch, which we give to the patients, we can go with these exercises, but always avoid excessive bending of the back while you are doing any exercises. These are some of the stabilization exercises which can be done on the ball. That can be hamstring stretch. You can also perform on the ball. All these exercises which we are going through, they are actually helping the mobility and the strengthening of the muscle. But one of the most important thing is that कि चाहे आप बॉल से कराओ, चाहे आप चेयर के सामने कराओ, चाहे आप पार्टनर स्ट्रेच कराओ, आप कुछ भी करवाओ, द मोस्ट इम्पॉर्टेंट थिंग्स कि उनका रिस्क ऑफ फॉल नहीं होना चाहिए. Because see, you are not dealing with normal patients, you are dealing with antenatal patients, you have a lot of responsibility there. So उनका balance effect ना हो, उनका risk of fall ना हो, that is your first priority. तो आप अपना एक्सरसाइज को उस तरीके से मॉडिफाई करोगे जिस तरीके से उनकी फॉल्स नहीं होना चाहिए. You should be standing there with them. If you have an assistant, stand with there. 3 people, 2 people should be there with the female around, so that risk of fall should be always less. On the ball exercise, you can always go with the posterior pelvic tilting exercises, that is placing the legs on the ball with knee flexion. Squatting with the Swiss ball, keeping the Swiss ball beside your back and then squatting. This can be done if the patient is having a lot of strength in the quadriceps muscle and the back muscle. अगर उनका अच्छा strength है, this is a very good exercises, very good exercise to strengthen the quadriceps muscle with the back muscle. Posture exercises you will be teaching to increase the to decrease the posterior anterior pelvic tilting. Next, you have cattle camel exercises, strengthening co-contraction of the muscles. We can always ask the person to go with the cat and camel and then contract the abdominal muscles, or they can go with this exercise with keeping chair in the front and then asking the patient to co-contract the abdominal muscles, or you can go with the exercises on the ball and then asking the patient to go with the co-contraction of the muscle. In the third trimester, you have certain kind of exercises which should be focused on increasing the posterior pelvic tilting, because third trimester में बहुत ज़्यादा weight increase हो रहा होता है, so anterior pelvic tilting भी उतना ज़्यादा बढ़ रहा होता है, तो posterior pelvic tilting exercises हमारे लिए उतनी ही important है. So these are some exercises which we should focus on in the third trimester, that is maintaining the mobility of the pelvis by doing the hip rotations. तो pelvic rotations आप करवा सकते हो. Progressive squatting, 5 count down, 3 count up, that is आप धीरे-धीरे पेशेंट का स्क्वाटिंग इंक्रीज़ कर सकते हो कि इस तरीके से कि आप होल्ड ज़्यादा रख रहे हो और रेपिटेशन आप कम कर सकते हो, ताकि हमारी क्वाड्रिसेप्स मसल्स में सबसे ज़्यादा स्ट्रेंथ। Duck walking is one of the most important exercise which is done in the third trimester, क्योंकि duck walking से हमारी basically pelvic floor muscles में blood supply बढ़ता है, adductors stretch होते हैं and automatically हमारा जो preparation है labor का वो शुरू होता है। तो जितना patient थर्ड ट्राइमेस्टर में अराउंड द 8th मंथ अराउंड द 9th मंथ डक वॉकिंग करेगा, उतना जल्दी उनको वॉलंटरी कॉन्ट्रैक्शंस होंगे और उतनी जल्दी उनको लेबर परफॉर्म होगा। पर इसका मतलब ये नहीं है कि वी आर एक्चुअली गोइंग फॉर द डक वॉकिंग द होल डे। नो, देयर इज अ प्रॉपर protocol. They should be doing duck walking like 6 to 8 times and then doing some exercises twice a day. Like जब और exercises हम करवा रहे हैं, strengthening करा रहे हैं, stretching करा रहे हैं, तो उसके साथ ही duck walking करें 5 to 6 rounds. They can go with the duck walking twice a day. Cat and camel exercises, simply you can go with progressive butterfly stretches, pelvic flow motion training and strengthening. So Kegel exercise is one of the most important exercises in these phase, which can help in strengthening of the pelvic floor muscles. And Kegel exercises is to be done in the various standing position or in the sitting position or in this supine position itself. So you have to change the position of the patient and then perform the Kegel exercises. You have pelvic bridging exercise and you have Swiss exercises on the Swiss ball, which is basically focusing on the quadriceps muscle. So these are some of the exercises which we can go with the antenatal patient itself. But there is always a scenario between first, second, and third trimester. In the third trimester, we are basically focusing on the Kegel exercise, that is holding the pelvic floor muscles and releasing it and doing it for 5 to 10 times with 10 seconds hold. And we are focusing on the pelvic floor muscles and we are focusing on the balance issues. In the first trimester, it is more of a mobility exercise. Not a lot of strengthening is required with the stretching. In the second trimester, it is more of strengthening, stretching, and the balancing exercises. So in the third trimester, we should be focusing on the more of the squatting, more of duck walking, and more of the pelvic floor strengthening. Because उस टाइम पे हमारी लेबर की प्रिपरेशन हो रहा होता है, तो उस टाइम पे हमें वो एक्सरसाइजेस करवानी चाहिए जिससे हमारा ब्लड सप्लाई इंक्रीज हो और जल्दी लेबर। So there is always a warning. अब आपके पास हम कहते हैं ना कि इंडिकेशंस तो पता होने चाहिए, पर उससे ज्यादा इंपॉर्टेंट है कि आपको कॉन्ट्रा इंडिकेशंस पता होने चाहिए. So always you have certain kind of contraindications which we have in the antenatal period, which is very important to note down. What are these? Is the bleeding of the vagina. जब bleeding है vagina पे किसी भी reason की वजह से, if the patient complains to you or if patient asks, you ask the patient, like if there is any other issue going on, if they complain to you कि उनको bleeding हुआ है, तो आपको नहीं करवाना है exercise. Increasing in fatigue levels, breathing problems, contractions, dizziness, fluid leakage from the vagina, increase heartbeat at rest. Increasing heartbeat at exercise is not a contraindication, but if you see the patient is coming to you or you are going to the patient और patient rest period पे भी उसका heart rate increase है, तो आपको exercise नहीं करवाना. ब्रीदिंग प्रॉब्लम्स, फटीक लेवल अगर बहुत ज्यादा इंक्रीज्ड है उनके, तो भी आपको एक्सरसाइजेस अवॉइड करने हैं उस पीरियड पे. यू कैन स्किप फॉर द 2 days एंड देन यू कैन गो विद द एक्सरसाइजेस. Next, one of the most important complications we have in the antenatal period is the low back and the back pain. That is because of the postural issue, the increased laxity and decreasing the abdominal functions. So back care is equally important while we are going with the antenatal patient. When sideline, placing pillow between the knees. So जब भी patient sideline में है, आपको pillow provide करना है between the knees. Adapting sexual activity to avoid full range of hip abduction. So we are actually adapting the sexual activity ताकि full range of hip abduction हो. And in the labor phases, it is very equally important कि उनका hip जो है वो abduction में रहे. Avoid climbing more than one step at a time. Swinging one leg out of the bed at a time when getting up or crossing the legs when sitting. तो ये सब अवॉइड करना है कि बहुत ज़्यादा स्ट्रेनस एक्टिविटी नहीं होनी चाहिए, क्रॉस लेग्स नहीं बैठना है ज़्यादा देर तक और ज़्यादा क्लाइंब नहीं करना एक स्टेप के अलावा। Diastasis recti is the separation of the rectus abdominis muscle in the midline, that is the linea apla. So any separation which is larger than 2 centimeter is significant. It is known as a diastasis recti. So prevention is always the better. We should always focus on strengthening the abdominal muscles by static abdominal exercise. जो हम basic supine lying, croup lying position में हम abdominal muscle की strengthening कराते हैं. We ask the patient to contract the abdominal muscles, hold it for 10 seconds and do it for 10 times. This is the way you can actually prevent the diastasis recti and with or some of the core exercises which can be included to avoid diastasis recti. Sacroiliac joint pain and dysfunction is very common in this kind of patients. So with good strengthening of the back, the pain gets reduced. There is a physical therapy provision for pelvic floor dysfunction, which is there. And there are certain points which we should notice on. First is the history taking and the evaluation of the pelvic floor muscles. Review of the bladder, if there is any chances of the urinary incontinence or leakage of the urine which happens. Assessment of the strength, endurance, and coordination of pelvic floor muscles. Development of individualized plan of care. So these are the 4 points which you should focus mainly on. कि पेशेंट ने क्या हिस्ट्री बताया, आपने इवैल्यूएशन में स्ट्रेंथ को जब चेक किया तो क्या एग्जैक्ट स्ट्रेंथ थी, यूरिनरी यूरिनरी ब्लैडर के कोई सिम्टम्स तो नहीं है, एंड व्हाट इज द एग्जैक्ट स्ट्रेंथ ऑफ द पेशेंट. Pelvic floor muscle strengthening for endurance and coordination is very important, and education regarding behavior stages to improve the incontinence is very important. So pelvic floor muscles से हमारा urinary incontinence के भी हमेशा chances कम रहेंगे, वो भी ठीक होगा. Urge suppression techniques, time voiding, tolerating strategies, bladder irritants should be discussed with the patient, and flexibility and strengthening of the pelvic floor muscles, postural and functional retaining of activities which are causing the dysfunctions is equally important. And if some modalities which can be needed is the biofeedback and the electrical stimulation. But if you can skip the modality, you can always skip. Go with the exercises if there is not a requirement for the biofeedbacks. So integrating pelvic floor, diaphragm and core is very important while we are dealing with the antenatal patients out there. So this is the way you can go with the pelvic floor basic exercise. So हम croup lying position में patient को लेंगे and then we ask the patient to contract the abdominal muscle. Inhale and exhale. Hold it for 10 seconds or 5 seconds according to patient and do it for 10 times. One of the most important recommendation in this is कि patient अपने आप count करे. जितना patient अपने आप count करेगा उतना वो breath hold नहीं करेगा. If you will count, patient अपना breath hold करेगा. So if patient counts, it is more easy and their breathing is in. Next exercises, you can go with the always the exercises on the back or the posture exercises, which can also be performed with the patient. This is also very good exercises for the abdominal muscles. We are placing one leg on the wall and we are asking the patient to contract the abdominal muscle, or we are placing one leg on the wall and one leg is on the air actually, and then we ask the patient to co-contract the abdominal muscles. This should be done in the second trimester if the patient is comfortable, not required or not important in the third trimester because the patient is having more physiological changes in the third trimester itself. Stress incontinence is one of the most important complication because it happens when the bladder leaks the urine during the physical activity or the exertion. So it may happen as one of the postnatal complication itself. Just a second. Pubic dysfunction exercises for the patient. If the patient is having sacroiliac dysfunction or the pubic symphysis dysfunction, then also we can go with the strengthening of the pelvic floor muscles and slight massage technique or the myofascial release technique so that the back muscles get released. Coming to the high risk pregnancy, if the woman is older than under the age of 17 or the over the age of 35, it is always a high risk pregnancy. So you should be always focusing on certain factors कि उनका ब्लड प्रेशर क्या है, उनका सारा जो टेस्टिंग है ऑर्गन्स की वो क्या है, किडनी की कोई प्रॉब्लम तो नहीं है, डायबिटीज तो नहीं है, ऑटोइम्यून डिजीजेस तो नहीं है, HIV तो नहीं है. 35 की एज के बाद जो प्रेगनेंसी है इट इज मोर कॉमन कि उनको हाई ब्लड प्रेशर हो और डायबिटीज हो. सो यू शुड ऑलवेज कीपिंग इन माइंड दैट what complications they can also have with the exercises. तो आपको एक्सरसाइज प्रोटोकॉल फिर बहुत वायलेंटली बनाना पड़ेगा क्योंकि अगर उनको डायबिटीज भी है और बीपी भी है, सो यू शुड ऑलवेज फोकस ऑन दी गाइडलाइंस which are given for the high BP patients also. Preeclampsia is a syndrome that includes high blood pressure, urinary protein and swelling, and it can be fatal for the baby and the mother. So preeclampsia बहुत common भी है because of lifestyle today's. It is one of the major complications. But with proper management, most women who develop preeclampsia have healthy babies. So exercise is one of the most important components in preeclampsia patients out there. जेस्टेशनल डायबिटीज को भी हमें कंट्रोल करना है. इफ द पेशेंट इज हैविंग जेस्टेशनल डायबिटीज, तो विद डायबिटीज वी कैन एक्चुअली कंट्रोल द शुगर लेवल्स थ्रू एक्सरसाइज. Now coming to the postnatal exercises after normal delivery, these were the antenatal care. After normal delivery, exercises can be started from the first day with all the precautions. So all the exercises and workouts should be started after 3 weeks, the proper workouts. But basic exercises like normal contraction of the Kegels on the first day or on the second day can be done. Or if the patient is able to walk, they can always go with the you can always make the patient walk on the second day itself. So all kind of exercises can be done except the jogging, jumping, hopping, heavy weight lifting, crunches up to 6 weeks. 6 weeks तक हमें पेशेंट को कोई heavy weight नहीं देना, not in the form of dumbbells, not in the form of weights, nothing, no jogging, no jumping. 6 weeks के बाद आप करवा सकते हो जो नॉर्मल स्ट्रेंथ है पेशेंट की उसके हिसाब से. तो आप पेशेंट को जो भी एक्सरसाइजेस अकॉर्डिंग टू देयर एमएमपी, अकॉर्डिंग टू द स्ट्रेंथ, आप वो सब करवा सकते हो. Standing crunches you can perform on the patient, planks you can perform, body weight exercises with therabands. I would suggest कि 6 weeks के बाद जब आप करवा रहे हो तो with start with the therabands. आप theraband से start करो, उसके बाद if the patient strength increases in the first month and the second month and after the second month of the exercise, then you can give them weights or the dumbbells. लो इम्पैक्ट एरोबिक एक्सरसाइज में आप वॉकिंग सजेस्ट कर सकते हो पेशेंट को कि वो वॉकिंग करे. पिलाटेस दे कैन परफॉर्म, लो इम्पैक्ट कार्डियो किक बॉक्सिंग दे कैन परफॉर्म, स्ट्रेंथ ट्रेनिंग विथ लो वेट्स. लो वेट्स के साथ आप 6 weeks के बाद इनिशियली आप लो वेट दे सकते हो, पर 2 महीने हो जाए, 2 months हो जाए, 3 months हो जाए, यू कैन ऑलवेज गो विद हायर वेट्स. कोर एंड एब्डोमिनल स्ट्रेंथनिंग जो कि हमारा प्लैंक से क्रंचेस से बहुत एनहांस होता है, वो परफॉर्म कर सकते हो. एंड पोस्टीरियर पेल्विक टिल्टिंग होल्ड्स, क्योंकि एंटीनेटल में पोस्चर में एंटीरियर पेल्विक टिल्टिंग होता है, तो इट इज वेरी इंपॉर्टेंट कि पोस्टनेटल केयर में वो ना हो. और पोस्टनेटल केयर इज अ डिफरेंट फेज. सो इफ द पेशेंट इज नॉट एक्सरसाइजिंग तो उनका एंटीरियर पेल्विक टिल्टिंग फिर होगा. सो हमें पोस्टीरियर पेल्विक टिल्टिंग पे फोकस करना पड़ेगा कि हम उसको एनहांस करें और पेशेंट का पोस्चर बेटर. All exercises after the C-section should be started after 6 weeks. If the patient has gone under a C-section, the first 3-4 days are very painful to them. They can always go with some kind of exercises in the 3 to 4. That is a basic one. We can go with some walking after 4 days. They can go with normal walking with assistance, like you are providing the assistance and asking the patient to walk. So up to 6 weeks, you can avoid giving them weights or doing some exercises. 6 weeks के बाद the patient can perform some light exercises. वो start हमेशा light exercises से करें. Normal walking, basic TheraBand, basic mobility, cat and camel, lion stretches, basic stretching of your trapezius, pectorals, and your biceps, triceps, hamstring, quadriceps. All these muscles should be focused on. But postnatal period के बाद 6 weeks के बाद you should never maintain stretch for a longer period of time in the initial days of exercise. हमें बहुत ज़्यादा स्ट्रेच ज़्यादा देर तक मेंटेन नहीं करना, क्योंकि ऑलरेडी द पेशेंट इज माइट बी हैविंग some of the muscle ligament laxity which is present at that stage also, so higher chances of getting tears in the injuries, तो वो भी हमें अवॉइड करना है। All kind of exercises can be done except the heavyweight trainings, sit-ups, back extension up to 3 months. 3 months के बाद आप back extension exercise करवा सकते हो। 3 months तक you should focus on lightweight exercises, focus on basic mobility exercises, and focus on basic strengthening exercises. This way you can go with in the postnatal period. You can go with the minor, mild crunches, abdominal contractions, and including the Pilates, slight mild Pilates, and go with the contractions of the abdominal muscles. On the Swiss ball, you can perform the posterior pelvic tilting exercises, and on the Swiss ball, you can always give them therabands, and they can perform with a light theraband in the initial stages. Planks, you can go if the patient is able to hold for 1 minute or 30 seconds, which is in first day with 30 seconds kar raha hai. Increase to 50, increase to 60 seconds, or increase to more. So this is a recommended weight gain which a woman should gain. Weight gain, underweight is this like 12.7 to 18.2 अगर उनका हुआ है. Normal weight gain is your weight gain is 11.4 to 16 kgs, and overweight can be more than that. So it is actually weight gain which is describing the part of the a patient rehab in the antenatal and the postnatal care. तो जितना उनका वेट ज्यादा इंक्रीज होगा उतना आपके लिए प्रॉब्लम होगा, बिकॉज उतना ही आपको बीएमआई पे फोकस करना है, उतना ही आपको स्ट्रेंथनिंग पे फोकस करना है, और उतना ही आपको वेट रिडक्शन पे फोकस करना है. सो नॉर्मल वेट विच शुड बी गेन इज सर्टनली नॉट इन अ मच अमाउंट. सो वो आपको ध्यान रखना पड़ेगा कि पेशेंट का पर टाइमेस्टर कितने कितने हिसाब से वेट गेन इंक्रीज हो रहा है, और पोस्टनेटल पीरियड में पेशेंट का वेट कितना इंक्रीज. So this is the weight gain which actually gets increased during pregnancy. Blood में हमारा 1.5 kg होता है. Fat storage में it is more of 3.5 kg. Body fluids is 1.5 kg. Breast is automatically giving you a weight of 0.5 kg, and baby का weight is 3 to 4 kg itself. So uterus meat is also getting into 1 kg, and amniotic fluid is 1 kg. सो नॉर्मल वेट गेन जो होगा वो 10 से 12 केजी का ही होगा, 10 टू 12 केजीज का. उससे अगर ऊपर जा रहा है मोर देन 14, मोर देन 15 केजेस, देन इट इज अ मोर ऑफ अ ओवरवेट काइंड ऑफ थिंग. Now let's come to the point that how much the energy and how much energy is required in the trimester itself. First trimester, a woman is required for the 100 calories, kcalories. Second trimester is 300. Third trimester is 300 calories. So we are not a dietitian itself, we are a physiotherapist, but we should always keep some knowledge of the dietary part, because when patient comes to you, they are coming for the tremendous thing, they are coming for the exercises, they are coming for the mental well-being, they are coming for the dietary parts. They will always ask you what to eat, what not to eat. So here we should need to do during pregnancy to ensure the weight loss, ताकि हमारा weight loss जल्दी हो. Choosing the whole foods, which are foods that are dense in nutrients, whole grains, unprocessed foods. Be sure that you get the right amount of calories. The patient is getting the right amount of calories, getting a serving of protein, carbohydrate, fat, and every meal. That will help us to break the meals into 6 mini meals per day and help prevent cravings. तो cravings ना हो तो उसके लिए हमें छोटी छोटी meals लेनी है. पेशेंट को यही सजेस्ट करना है कि वो 6 छोटी छोटी meals लें. Choosing foods which are high in fiber, because that will help in getting the complication of constipation. Drinking extra water, because hydration is equally important, that help us to flush the toxins from the body. So hydration is very important, and hydration is very important in the most important in the third trimester, because उस time पे body prepare हो रही होती है labor के लिए. Importance of good nutrition during pregnancy is important before, during, and after pregnancy. So our eyes should be on the weight. हमारा आइज होता है वेट पे कि वेट कितना इंक्रीज हो रहा है, ब्लड प्रेशर का क्या लेवल है और ब्लड ग्लूकोज का क्या लेवल है। और अगर पेशेंट को ऑलरेडी बीपी हाई है, डायबिटीज है, देन देयर आर हायर चांसेस ऑफ गेटिंग कॉम्प्लिकेशंस। सो आपको फोकस करना पड़ेगा 3 फैक्टर्स पे। वेट गेन कितना इंक्रीज है, बीपी कितना इंक्रीज हो रहा है एंड ब्लड ग्लूकोज कितना ज्यादा इंक्रीज हो रहा है, ताकि हमें पता चल सके कि बेबी पे ज्यादा इम्पैक्ट तो। इफेक्ट्स फीटल एंड प्लेसेंटल ग्रोथ। तो जितने भी ये सारे फैक्टर्स हैं, बीपी, डायबिटीज एंड योर इंक्रीज वेट गेन, दे ऑलवेज हैम्पर्स द चाइल्ड्स ग्रोथ, बेबीज ग्रोथ। इफेक्ट्स द मेंटल वेलबींग एंड द मेटरनल आउटकम्स ऑल्सो। तो अगर ज्यादा वेट गेन होगा, डायबिटीज होगा, बीपी होगा, so automatically patient को stress होगा, so female will be under a more stress position right there. Not getting enough micronutrients will also causes low birth weight, premature birth and fetal problems. बहुत important है कि अगर हमने sufficient nutrients भी नहीं दिया तो ऑटोमेटिकली बेबी का बर्थ वेट भी कम होगा, प्रीमेच्योर होगा और कॉम्प्लिकेशंस होगी। तो सही कैलोरीज देना, ज्यादा कैलोरीज नहीं देना एंड लो कैलोरीज देना इज इक्वली इम्पोर्टेंट। Micronutrients include your folic acid, iron, omega-3 fatty acids, vitamin A, calcium, vitamin D, and iodine. Folic acid reduces the risk of having a baby with the neutral effects. So it reduces the risk of premature birth, and recommended amount we have is 0.4 milligrams, that is 4 micrograms per day. तो इतना folic acid हमें लेना होता है, and with the medication it is more suitable कि पेशेंट मेडिकेशन ले तो उससे बहुत इजीली उसका एब्जॉर्ब होता है बॉडी में। गुड सोर्सेज कैन बी ग्रीन लीफी वेजिटेबल्स एंड सम सीरियल्स अराउंड। आयरन, आयरन से प्रीमेच्योर बर्थ के रिस्क बहुत कम होते हैं, बर्थ लो बर्थ वेट के चांसेस बहुत कम होते हैं। एंड नॉट गेटिंग इनफ आयरन कैन कॉज एनीमिया, which can also develops to the development delays and behavior disturbances in the infant and the poor health in the mother. तो हमेशा आयरन का इंटेक भी बहुत अच्छा होना चाहिए, बिकॉज इससे डेवलपमेंट डिले नहीं होता इन्फेंट्स में भी, और मदर को भी इश्यूज नहीं होते। Contributing to death and the other diseases if the anemia is severe. अगर anemia severe है, so there are higher chances of fatal, which is happening. Anemia is very essential for the normal infant brain development, and it helps to create blood. It helps in blood making. So it is necessary for fetal demands and the blood loss during delivery. So delivery के टाइम पे जो normal delivery के टाइम पे जो blood loss होगा, उसमें भी iron की हमें need है, हमें hemoglobin की need है. So iron का maintain रहना throughout the 9 months is very important. Good sources can be lean red meat, green leafy vegetables, breakfast cereals. Another, which is one important, is the omega-3 fatty acids, which is equally important for the brain development, and it is essential for the visual development of the baby. Reduces incidence of heart disease and heart-related death of the infants, and recommended we have 300 milligrams per day. Good sources can be fish oil capsules, which can actually help. Certain fish, such as salmons, fishes, and the sardines and the fresh tuna. Vegetable oils, such as sunflower, rapeseed, flaxseed, and walnut oils. Next, one of the most important component which actually help us as a physiotherapist is the calcium and the vitamin D. क्योंकि जितना कैल्शियम विटामिन डी अच्छा रहेगा थ्रू आउट द एंटीनेटल पीरियड, उतना पेशेंट अच्छे से एक्सरसाइज कर पाता है। बिकॉज अगर कैल्शियम ही कम है, विटामिन डी ही कम है, फॉस्फोरस ही कम है, तो पेशेंट विल नॉट बी एबल टू डू एक्सरसाइजेस, तो हमारा रोल फिर बहुत कम हो जाएगा। सो एंटीनेटल और पोस्टनेटल पीरियड में बहुत इंपॉर्टेंट है कि कैल्शियम और विटामिन डी का लेवल क्या है। So calcium and vitamin D level are needed for the strong bones and teeth we need, and it is important for the formation of fetal bones. Fetal की bones के लिए, मदर की बोन्स के लिए, मदर की मसल्स के लिए बहुत इंपॉर्टेंट है कि कैल्शियम और विटामिन डी का लेवल बहुत अच्छा हो। तो हमें फीटल डेवलपमेंट में भी जब अल्ट्रासाउंड होता है, वी हैव वेरियस अल्ट्रासाउंड्स व्हिच हैपेंस इन द प्रेगनेंसी पीरियड, तो उसमें हमें पता चलता है कि फीटल की बोन्स कैसी हैं। तो अगर कैल्शियम इंटेक अच्छा नहीं है तो उनकी बोन फॉर्मेशन में बहुत इश्यूज होते हैं, एंड आफ्टर द चाइल्ड तो दे कैन हैव अनदर इश्यूज ऑफ rickets and everything. Recommended is 1000 mg of calcium per day. So if you compare to the another nutrients, like vitamin D, nutrients which we discussed is the folic acid, the iron, calcium सबसे ज्यादा, क्योंकि कैल्शियम का रोल बहुत ज्यादा है हमारे बॉडी स्ट्रक्चर को बनने में. Good sources can be 8 ounces of skim milk, that is 300 grams, 300 mg of milk. 1 cup plain milk yogurt is equally effective. Orange juices, spinach, cottage cheese, sesame seeds, dry roasted almonds. These are one of the food dietary modifications which we can done to increase the calcium. Vitamin A, which is needed in small amounts to protect fetus from the amounts immune system problems, like it helps in the blindness and infections and death. So, lack of iodine can contribute to stillbirths, birth defects, and decreased brain development. So, हमें विटामिन ए आयोडीन का लेवल भी पता होना चाहिए ताकि आई इश्यूज ना हो बेबी को. आयोडीन is important for brain development also. Proteins are essential nutrient for strengthening your back, muscles, breast, uterus, and baby tissues. So it also improves the blood supply to the body. So an average of 65 gram of protein per day is required during pregnancy. And good sources can be egg, calcium, folic acid, iron, vitamins, and minerals. They are key nutrients for good prenatal nutrition. So if the patient is having a good nutrition, जितना उनका कैल्शियम अच्छा है, जितना उनका फॉलिक अच्छा है, जितना उनका आयरन विटामिन अच्छा है, तो ऑब्वियसली उनके फीटल डेवलपमेंट के एबनॉर्मल फीटल डेवलपमेंट के चांसेस हमेशा कम होंगे एंड कॉम्प्लिकेशंस नहीं होगी प्रेगनेंसी में. कॉम्प्लिकेशंस अगर नहीं होगी प्रेगनेंसी में तो आप अपना रोल बहुत अच्छे से कर सकते हो एज अ फिजियोथेरेपिस्ट, बिकॉज इफ देयर इज वन और द अदर कॉम्प्लिकेशंस तो हमें अपने एक से ज्यादा अच्छा तभी दिखेगा जब हमारा फीमेल की बॉडी का न्यूट्रिशन अच्छा होगा एंटीनेटल पीरियड. Fats, the average daily requirement is 400 grams. A total of 5 teaspoons of oil is enough to provide this amount in a day. Vitamin B12. Vitamin B12 की deficiency से already nerves issues होते हैं. So vitamin B12 बहुत ज़्यादा important होता है nervous system के लिए, baby के लिए भी और mother के लिए भी. So it is present in animal and dairy foods, and pregnant women who are actually vegan diet, who have a vegan diet, will have to give take vitamin B12 supplements. फिर उनके लिए बहुत important है कि vitamin B12 के वो supplements लें. Foods which needs to be avoided now, कि अब हमें क्या avoid करना है? Processed foods, junk foods, not lot of caffeine, alcohol, trans fat, artificial and refined sweeteners, fried foods, food additives, fabricated soys like fake meats and protein powders, and soy products of all the kinds. Some kind of protein powders are actually given by the gynecologist. So if one of your patients is actually taking the protein powders, so they can always go with the consultation with the gynecologist and what she says about it. Nausea and vomiting, which are associated with in the antenatal period, it actually increased the level of associated with increased level of HCG. It peaks at the 12 weeks gestation. And what are the strategies which we can give to the patient? And snacks, हमेशा छोटी छोटी snacks लो, छोटी छोटी meals लो. Plenty of hydration, drink fluids between meals. Caffeine नहीं लेना है, no tea, no coffee. Reduce citrus and peppermint and peppermint foods. Limit spicy and high fat foods. Avoid lying down just after eating. So it is always suggest to the patient, हमेशा lunch के बाद, dinner के बाद, breakfast के बाद, take a walk and then sit after 10 minutes. Take a walk after meals and wear loose fitting clothes. No alcohol and limit caffeine, because fetal abnormalities के बहुत ज़्यादा chances होते हैं caffeine और alcohol लेने से, and chances of low birth weights. For the stretch marks, what are the tips you can give to the patient? Maintaining healthy weight within the range, that is 10 to 12. Exercising regularly ताकि हमारा blood circulation body का बहुत अच्छा रहे, upper limb में भी, lower limb में भी, और pelvic floor muscles में भी. Maintaining a healthy lifestyle that includes your strengthening, stretching of the muscles and the food dietary habits. Massage and moisturizing the skin. Plenty of water to keep your skin hydrated. And if the symptoms are persisting with the nausea and vomiting and the stretch marks, always go with the medications. And stretch marks always takes time to fade. So we always have some or the other moisturizer or gel creams to heal with that. तो वो हम provide कर सकते हैं patient. I think this is done. This is from my side. If any of the questions or doubts, I can solve it for you people. I'm there. Any doubts or questions you have? I hope you just got a basic idea, like if you by chance got a patient of antenatal care, what kind of exercises you can go for. Because as physiotherapist, एक basic idea होना बहुत ज़रूरी है कि हम कहते हैं कि हम strengthening provide करा रहे हैं, but what kind of strengthening, what kind of strength they have, and what kind of flexibility they have is very important. तो एक बेसिक आइडिया आपको होना चाहिए कि हाँ दिस exercises are important in this trimester and this exercises are important in this trimester. And with the dietary part, you should be focused on all the nutrients which we have discussed. Any other doubt or any other questions which I can handle, you can pin in the chat box. Yeah, how can we teach the patient for activating their core muscles? We can always ask the patient to go in this croup lying position, and you can ask the patient to co-contract the abdominal muscle. जो भी आपकी ट्रांसवर्स एब्डोमिनल की मसल है आप उसको कॉन्ट्रैक्ट करो, होल्ड इट फॉर 10 seconds and do it for 5 to 10 repetitions in the croup lying position. और आप कैसे करवा सकते हो, आप स्विस बॉल पे पेशेंट को सिटिंग पोजीशन पे बिठाओ and ask the patient to contract the tummy and release. Contract the tummy and release. Hold it for 5 seconds and then release. Because आपको फोकस करना पड़ेगा कि आप किस किस वेरियस पोजिशन के साथ आप कॉन्ट्रैक्शन करवा रहे हो एब्डोमिनल मसल्स की. क्रूक लाइन में करा सकते हो, सिटिंग में करा सकते हो, स्टैंडिंग में नहीं कराना, दैट इज अ कॉन्ट्रा इंडिकेटरी पार्ट. क्रूक लाइन में कराओ, स्विस बॉल पे कराओ एंड सुपाइन लाइन. Next question is in the ma'am in the third trimester how we should maintain a post pelvic tilting. That is through exercises of the back, like जो मैंने exercises आपको show किया था कि Swiss ball को आप place कर सकते हो in front of the wall, and then you can place both the legs on the Swiss ball and ask to bridge to glutes bridge. तो आप bridging करा सकते हो अपने स्विस बॉल को सामने रख के, एंड देन यू कैन आस्क द पेशेंट टू ब्रिज, डू विद द ब्रिजिंग, एंड देन द पोस्टीरियर पेल्विक टेंटिंग विल इंक्रीज. और आप स्विस बॉल के ऊपर ही सिटिंग में ही जैसे हम नॉर्मल करवाते हैं पेल्विक टिल्टिंग, आप वैसे करवा सकते हो. एंड फोकसिंग ऑन कैटल कैमल लाइन स्ट्रेचेस, बेसिक बैक स्ट्रेंथनिंग, द पोस्टीरियर पेल्विक टिल्टिंग एक्सरसाइजेस विल वर्क. तो इन सब चीजों से हमारा एंटीरियर पेल्विक टिल्टिंग ठीक हो जाएगा, कोर मसल्स की स्ट्रेंथनिंग से, बैक मसल की स्ट्रेंथनिंग से, एंड स्विस बॉल की एक्सरसाइजेस. Hydrotherapy is indicated in prenatal and postnatal pregnancy. Yes, hydrotherapy should be included in the prenatal period, but in India it is not of right now. It is not more of a tradition that is going on in the basic exercise protocol कि हम hydrotherapy कराएं. Some people do it, but it should be done with proper precautions. बिकॉज हमारे अभी इस पे एंटीनेटली में इतना ब्लूम कर रहा है, इतना अच्छे से चल रहा है, वी आर गोइंग विद द बेस्ट ऑफ स्ट्रेंथनिंग एंड द स्ट्रेचिंग एक्सरसाइजेस. सो हाइड्रोथेरेपी में देयर लॉट ऑफ रिस्क आल्सो व्हिच इज एसोसिएटेड. So it can be done in the prenatal period, of course, but with precautions and with proper care. And some recommendations are there in the hydrotherapy which needs to be get read through. Yes, CTS is basically because of increased joint laxity, but it is more increased because of the nerve compression of the medial nerve. तो अगर पेशेंट को ऑलरेडी नेक पेन है, सर्वाइकल पेन है और पेशेंट एक्सरसाइज नहीं कर रहा, तो हायर चांसेस है कि उनका जॉइंट फ्लैक्सिसिटी हो और नर्व कंप्रेशन हो. क्योंकि फॉर एग्जांपल इफ द पेशेंट इज ऑलरेडी a laptop worker, और वो एक्सरसाइज नहीं कर रहे, नेक में भी पेन है, बैक में भी पेन है, शोल्डर में भी पेन है, सो उनके सीटीएस के चांसेस बहुत ज्यादा बढ़ जाएंगे, क्योंकि उनका प्रोफेशन ऐसा है, और प्लस वो अभी एंटीनेटल की स्टेज पे है. So, what you can go with the patient is always decreasing the compression on the cervical itself. तो आप जैसे हम नेक पेन को नॉर्मली ट्रीट करते हैं, आप सीटीएस के पेशेंट को भी नॉर्मली ट्रीट कर सकते हो, बट विद नो मोडालिटीज. ट्राई टू गिव नो मोडालिटीज. Go with the manual techniques. Go with the mobilization or manual therapy exercises, light massage techniques, and give them basic strengthening of the wrist muscle exercises, which we generally do in CTS patient. तो वो भी आप करवा सकते हैं. You can go with the first. You should always go the basic gynecological book, which is low, which is there, जो हम follow करते हैं, and then you can go with antenatal and postnatal various articles. I would suggest, rather than the book, I would suggest go with the basic articles first, and see the guidelines which are provided by the various associations. Like for the American Academy, what are their guidelines? Because we have certain books, but there is some of the other contraindications which is present in one or the other patient. So evidence practice includes the your help with the articles. तो जितना आप आर्टिकल्स पढ़ोगे, जितना आप रिसर्चेस पढ़ोगे, उससे आपको इन्फॉर्मेशन बहुत वैलिड मिलेगा, एंड यू ऑलवेज हैव a particular point to the opposite person that why you are giving this exercise. So read articles and read researches about that. Yes, I can share the PPT in the WhatsApp group. No worries. You can always follow. What is a tense placement for the postnatal patient? Depends on the postnatal pain. If the pain is at the back, you can always place the, if it's center of the back, then you can go with the two polar methods. And if it is radiating, कि अगर रेडिएटिंग है तो फिर आप रेडिएटिंग पैटर्न में लगा सकते हो. सो इट बेसिकली यू कैन डिसाइड ऑन द पेन पैटर्न ऑफ द पेशेंट. अगर सिर्फ बैक पे है तो आप टू पोल करके लगा सकते हो, और इफ इट इज देयर इन द लोअर लेग, your lower leg or the bilateral legs, you can go with the four pole. Okay. Any other questions? I think we are done. I hope we are done, Abhishek. Okay. Thank you. Thank you so much. Thank you so much. Thank you,
Thank you
everyone
so
out
much,
there.
Sona
Thank
ma'am.
you.
Thank you
Thank
so
you. Thank you
much
so
for joining
much.
in.
Thank you. Bye bye.